For 3 decades, the 340B drug pricing program has enabled hospitals that serve high numbers of low-income patient populations to stretch scarce federal resources and provide more comprehensive care to their patients and communities. The program, which has enjoyed strong bipartisan support, does not cost taxpayers a dime. Instead, the program is subsidized by drug companies, which are required to sell certain outpatient drugs at a discount to eligible providers. These discounts help hospitals provide critical programs and services to their patients, such as medication therapy management, diabetes education and counseling, and mobile treatment clinics for rural areas. Ask any hospital in the 340B program, and they'll tell you it's done a great deal of good for the patients and communities they care for, which is why current efforts by drug companies to reduce the program's scope are so alarming. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. In this podcast, an AHA policy expert explores the value of the 340B drug pricing program and the negative impact that efforts to scale back the program have had on patients and providers. He's speaking with a hospital administrator for whom the 340B program has served as a critical resource in their ability to serve patients.
I'm Bharat Krishnamurthy, AHA Senior Associate Director of Health Analytics and Policy, and I'm joined today by Ellie Amory, a Health System Revenue Cycle Analytics Manager at Meadville Medical Center. Meadville is a 200-bed independent community health system with 3 acute care campuses and a 32-bed skilled nursing facility, serving a predominantly rural community in Crawford County, Pennsylvania. Ellie's role includes serving as the hospital's 340B administrator. The 340B drug pricing program was created by Congress in 1992 to protect safety net hospitals from escalating drug prices by allowing them to purchase outpatient drugs at a discount from drug manufacturers and then use those savings to stretch scarce federal resources to provide more comprehensive care for patients. For 30 years, the program has successfully allowed eligible hospitals to provide critical programs and services to the patients and communities they serve, while managing rising prescription drug costs. Today, Ellie will share how Meadville's 340B savings have enabled the medical center to serve their patients and remain on the front lines of the COVID-19 pandemic, while facing significant threats from drug companies seeking to reduce the scope of the program, all while weathering immense financial and operational challenges due to the pandemic. So, Ellie, can you tell me a little bit about your hospital, what kind of services and programs you provide, and the types of patients and communities you serve?
Sure. So, as you mentioned, we are a multi healthcare facility. We are located in Crawford County. Our location in Meadville is on the western side of Crawford County. In addition to the acute care facility, we also, on the inpatient side, have a skilled nursing facility, rehab, and inpatient drug and alcohol counseling. On the outpatient side at our Meadville facility, we have several provider based clinics, which are beneficial to the 340B program, such as dermatology, nephrology, neurology, pain management, behavioral health services. And then we have a cancer clinic, which offers both medical and radiation oncology services. And then outside of 340B, we have several other specialty providers that are non-provider based. So we also have cardiology, endocrinology, gastroenterology, and several primary care practices as well. On the Titusville side, Titusville is on the eastern side of Crawford County. They're a critical access hospital, and they also have several rural health clinics that cover pretty much all of Crawford County. They're throughout all of our territory. And a lot of our specialty providers at Meadville also see patients at Titusville as well. And our community is mainly rural. All of Crawford County is pretty rural, and I would say that we have a very high Medicaid and Medicare population.
Great. So, as a hospital serving primarily a rural area, I'm sure the 340B drug pricing program is critical to your hospital and health system. Can you tell me a little bit about your hospital's 340B program, how you use the savings from the program to directly benefit the patients you serve?
Sure. So Meadville joined the 340B program clear back in 2011 as a sole community hospital. In 2013, our DISH percentage actually was above the 11.75%. So we re enrolled in the program as a DISH covered entity. That allows us to receive 340B pricing on orphan drugs, which a lot of cancer drugs are orphan drugs. And as I mentioned, we have a cancer center in Meadville, and it's a relatively new addition to our community. It was a very important addition to our community. Prior to opening our own cancer center, patients of Crawford County had to travel either 90 minutes south to Pittsburgh, 90 minutes west to Cleveland, or 45 minutes north to Erie. And that doesn't seem like a lot, but if you're a patient and you've just had chemotherapy and then you have to ride 45 minutes or 90 minutes in a car ride, it definitely was a much needed service in our community. So being able to purchase 340B drugs at that discounted price, especially on really expensive cancer drugs, definitely benefits our community. Some other services that we offer primarily that are benefited by the 340B program would be we have a population health management program that does not bring in any revenue. It's funded a lot by the 340B program, and that is a bunch of nurses, and I think it's overseen by one physician, and they make sure that patients adhere to their follow-up visits and that they're adhering to their medication management as well. And then I would also say that the 340B program benefits our rural health clinics as well, in particular the dental service that we offer at our rural health clinic and behavioral health services, which is much needed in our community as well.
Great. So it seems like your 340B program benefits a lot of critical programs and services that are really critical value to your patients. But I want to pivot for 1 second. One of the key components of the 340B program is your ability to contract with external pharmacies, also known as contract pharmacies. Can you tell me a little bit about your hospital's 340B contract pharmacy program, how many contract pharmacies you have, and more specifically, why you have that number of contract pharmacies and what value those contract pharmacies provide to your patients?
Meadville has 47 contract pharmacy relationships, and Titusville has 41 contract pharmacy relationships. We chose all of them initially just by the physical location of being within the county. So, any of the pharmacies that our patients would be going to with their prescriptions, we chose to have a contract pharmacy relationship with them. We've expanded that recently within the last year or so to include a lot of specialty pharmacies. That makes up the majority of the 47 and the 41. And the reason for that, mainly, as I said, our cancer center, cancer drugs are specialty drugs. And those specialty pharmacies do a lot more for the patients other than just provide them their drugs. A lot of them do prior authorizations, making sure that the drug is authorized. They help them with refills. I know of one specialty pharmacy in particular that offers financial assistance. They give back a lot to their patients. Other contract pharmacies that we have more so on the retail side, I would say, have care cards that they offer at 340B programs where they offer discounts so patients pay less for their drugs. We were just beginning to explore a care card program with one of our major retail pharmacy chains when the drug manufacturer mandates began. So we temporarily put that on halt, but that's something that we're definitely interested in to benefit our patients.
Great. And as many of our listeners know, over the past year, several of the largest drug companies have denied 340B pricing through your contract pharmacies. What impact has that had on your hospital, both in terms of financially, but also in terms of your ability to care for your patients?
Financially, it has impacted our organization by over $1 million, not only on lost revenue, but on labor resources that we've had to input to track all of the mandates and to make sure that we're getting all of the 340B pricing that we need to be getting. Patient wise, I don't think that it has impacted patient care yet, but if the mandates continue, it'll make the organization take a really hard look at some of those services that I mentioned that were critical to our community. If they're operating at a loss and we don't have the 340B revenue to compensate for that, we may have to take a look at closing some of those services that our community needs.
And just to follow up on that, for especially some of the rural communities you serve, you mentioned that they would have to travel long distances if your facilities weren't available to provide them, for example, cancer care, chemotherapy care. Would it be a situation where if you lost this 340B savings, those patients would then have to travel to Cleveland or Pittsburgh to get that kind of care?
Yes. Yes, it absolutely would.
Great. And then following up on another point, these same drug companies have also asked hospitals like Meadville to report data to a third-party vendor called 340B ESP in order to be eligible for any 340B discounts. Has your hospital complied with this request? And if so, what have been the biggest challenges for you to comply with this request?
Initially, we did not. We did not want to share our data. We were nervous about what they were going to use our data for. Also had to reach out to each of the contract pharmacies and to each of our three TPAs to get their approval to be able to upload the data to ESP. We received the approval from all of them except for one contract pharmacy, which we are not uploading the information for. But we also, each of the manufacturer mandates have an exclusion for a wholly owned contract pharmacy. So they'll say they're not going to give you 340B pricing at any contract pharmacies unless it's a wholly owned contract pharmacy that the entity owns. So we actually purchased a pharmacy in the beginning of all of these mandates as a way to try to help our patients and still be able to receive the 340B pricing. And that was our way of kind of holding out. We didn't realize at the time how many more manufacturers were going to jump on the bandwagon. So I would say after the beginning of this calendar year, when several more jumped on the bandwagon and we realized what a financial loss it was to our organization, we realized we couldn't hold out anymore. And we began uploading the data on March 16th of this year.
So one thing that we've heard recently is that there is no standardization between the data requests coming from the manufacturers. Can you speak a little bit to that point and what kind of impact that's had on burdening your staff in terms of staff time and labor costs?
So that has definitely been the biggest challenge is the amount of staff time. The time to download the reports isn't really that significant, other than the fact that, as I mentioned, we have three different TPAs and each have a different process of where you're supposed to go to download the information. And then our financial analyst downloads them all, formats it into the ESP required format, and then uploads it. I would say pretty much every time that he has uploaded the data, which is on the 1st and the 16th of each month, each time that he uploads it, we receive errors for something wrong with the formatting that he has to go back and change. But that's not the hard part. The hard part is then after you upload the data, tracking to see when the manufacturers have actually released your pricing. A lot of them have mandates that say within 10 to 15 days of uploading the data, they'll release your pricing to you. But as I said, we started on March 16th, and there are still several manufacturers that we have not received any 340B pricing for. So we have numerous spreadsheets tracking when we've uploaded the data, if we've started receiving the pricing or not. And then our 340B analyst's job description was completely changed, where he now is monitoring all of our 340B account invoices on a daily basis. And he runs invoice reports on a regular basis where he's monitoring to make sure we're getting the 340B pricing at contract pharmacies that we should be receiving them for those manufacturers. He's looking to see if we previously purchased a lot of drugs for a certain manufacturer at a certain pharmacy, and now all of a sudden no invoices are coming through, meaning they're blocking us and we're not getting any of that pricing. He's relaying that to our 340B coordinator, who then reaches out to the wholesaler and sometimes to the manufacturers directly to try to get the pricing reinstated. He's also monitoring to make sure that the TPAs have the blocks in place so that 340B pricing isn't going through if something should be blocked, or if we have received the updated pricing that they're allowing it to allow the pricing go through. Some of the issues we're having lately is our TPAs allowed some 340B pricing to go through that shouldn't have. For example, Novartis, which is blocking contract pharmacies outside of a 40-mile radius from your physical location, they allowed some to go through. And now here we are several months later, and we're receiving credit rebills, having to pay WAC pricing for these cancer drugs, costing us hundreds of thousands of dollars for something that shouldn't have ever gone through.
Well, I want to thank you, Ellie. I really appreciate your report from the front lines, highlighting the benefits of the 340B program to the patients and communities served by Meadville Medical Center. It's clear from your report that drug companies' actions to deny 340B pricing through your contract pharmacies is having a direct negative impact on your ability to care for your patients. Stories like yours are important to illustrate both the value of the 340B program and why reducing the program's scope directly harms patients who rely on the program's benefits. I also want to thank you and your colleagues at Meadville Medical Center for all you're doing and have done throughout the pandemic and beyond.
Thank you. Thank you for having me.